You wake up and your eyes feel like sandpaper, gritty, scratchy, and it takes the better part of an hour before the world comes into focus. Or you're sitting in a restaurant, the light is a little low, and you're squinting at the menu, holding it closer, then farther, hoping no one notices. And the driving at night, the headlights of oncoming cars don't look clean anymore, they scatter into halos, into starbursts. Your hands grip the wheel tighter than they used to, not because the road changed, because you're not sure about what you're seeing. If any of that landed, drop your city or country in the comments right now. Because what I'm about to share is the conversation I wish I had time for with every single patient I've worked with. My name is Dr. James. For over 20 years, I've specialized in evidence-informed natural approaches to eye health, working alongside ophthalmologists and retinal specialists, not instead of them, with them. Your eyes are too important to gamble with. Please see a licensed eye care professional before making any changes. This is meant to complement your conventional care, not replace it. Now, here's what most people believe, that blurry vision and dry eyes are simply what aging looks like. Inevitable, just something you manage. The American Optometric Association and the National Eye Institute both confirm that vision loss in adults over 60 is rising faster than at any previously recorded point in history. Conditions like dry eyes, cataracts, and macular degeneration are accelerating, and these are biological processes driven by specific, identifiable mechanisms. Not just the price of getting older. Here's what changes everything. The most critical window of retinal damage and repair happens while you sleep. Your retina, the light-sensitive tissue at the back of your eye, depends on oxygen and nutrients delivered through tiny capillaries during deep sleep to regenerate photoreceptor cells. When that delivery is compromised by oxidative stress, inflammation, or poor circulation, damage accumulates silently. Most people don't notice until it's already significant. The good news: recent research has identified specific fruits with compounds that directly support that overnight repair window, improving retinal circulation, neutralizing oxidative damage, and in some cases measurably slowing macular degeneration. Today I'm counting down the 7 most powerful, from good to extraordinary, with exact timing, preparation methods, and the pro tips most people miss entirely. And the number 1 fruit on this list, one most of you already have in your kitchen, contains a natural enzyme shown to interfere with one of the most destructive and most overlooked processes behind cloudy lenses and early cataract formation. I'll name it when we get there. Let's count down. Number 7. Kiwi. The problem it addresses. Waking up with dry, scratchy eyes and gradually dulling visual sharpness, particularly in the morning. Kiwi contains lutein and zeaxanthin, 2 carotenoids that concentrate in the retinal layers and act as the eye's internal antioxidant shields during overnight repair. It also contains a small amount of naturally occurring serotonin that supports deeper sleep, the window when photoreceptor regeneration is most active. A study in the Journal of Nutrition and Healthy Aging found that adults consuming 2 golden kiwis daily experienced measurable improvements in visual sharpness and significant reductions in morning dryness within weeks. Use golden kiwi, not green. Higher lutein content, less acidic, easier on the stomach before bed. Eat 2 60 to 90 minutes before sleep, paired with a small amount of almond butter for fat-soluble absorption. PRO tip: most people scoop to the skin and discard the outermost layer. Don't. The flesh directly beneath the skin is the richest source of caffeic acid, a potent antioxidant. Eat close to the skin, leave nothing behind. Margaret, 61, a retired teacher, described her mornings as looking through frosted glass for the first hour. 6 weeks of 2 golden kiwis with walnuts each evening, and she told me, it clears within minutes now, like the lights have been turned up. Next, a summer fruit most people write off as a snack. Its impact on the capillaries, supplying your retina overnight, is far more significant than its reputation suggests. Number 6. Watermelon. The problem: morning blurriness and visual fatigue. Eyes that haven't quite woken up even after a full night of sleep, often a circulation issue. Watermelon is one of the richest dietary sources of lycopene, linked in observational research to reduced oxidative damage in retinal cells and protective associations with both cataracts and macular degeneration. It also triggers nitric oxide production, which relaxes and widens the capillaries supplying the retina during sleep, improving the oxygen delivery your photoreceptors depend on overnight. Observational research shows regular watermelon consumers carry measurably higher circulating levels of lutein, and zeaxanthin, lycopene appears to support the broader carotenoid absorption system, making other protective compounds more available to retinal tissue. 2 cups of fresh watermelon 60 to 90 minutes before bed with a drizzle of olive oil or alongside pumpkin seeds for fat-soluble absorption. PO tip: never add salt. Sodium raises intraocular pressure, identified by the Glaucoma Research Foundation as a significant risk factor for irreversible vision loss. And don't discard the white rind. It contains citrulline, an amino acid that supports healthy blood vessel function. Blend a small piece into a smoothie. The flavor disappears. The benefit doesn't. Number 5 targets something that rarely gets discussed: your eye's ability to shift from light to dark, and what happens when that ability quietly starts to slip. Number 5. Black currants. The problem: impaired dark adaptation. The difficulty your eyes have moving from bright to dim environments. That uncomfortable lag before your vision adjusts. Alongside this, reduced optic nerve blood flow and chronic retinal microinflammation. Black currants contain extraordinarily high concentrations of anthocyanins, doing 3 things simultaneously: calming retinal microinflammation, supporting vascular dilation in the optic nerve's blood supply, and helping restore rhodopsin, the visual pigment your rod photoreceptors use to adjust from bright light to darkness. When rhodopsin is depleted or regenerates slowly, your dark adaptation suffers. A randomized placebo-controlled trial found that 50 milligrams of blackcurrant anthocyanins daily over 24 months significantly improved optic nerve head blood flow and measurably slowed visual field loss progression in glaucoma patients. A separate pilot study showed normalization of endothelin, a vessel-constricting compound, without affecting intraocular pressure. Fresh blackcurrants are rarely available in grocery stores. Use a standardized blackcurrant anthocyanin extract, approximately 50 milligrams, taken in the evening with food. Pro tip: pair with a small amount of healthy fat and a vitamin C source. Half a kiwi, a small orange. Vitamin C has been shown to significantly enhance anthocyanin absorption, creating a synergistic effect that delivers meaningfully more of the compound to ocular tissue. Number 4 goes deeper, to the DNA inside your photoreceptor cells. And the fruit that reaches it is one you think you know. But there's a version most people have never considered. Number 4, wild blueberries. The problem: accelerating oxidative DNA damage in photoreceptor cells, the rods and cones that convert light into vision. When this damage accumulates faster than cells can repair, visual acuity decreases, and eye strain in low light increases. The key compound is pterostilbene, related to resveratrol, but significantly more bioavailable, and crucially, it has been demonstrated to cross the blood-retinal barrier. Most dietary antioxidants never reach retinal tissue in meaningful amounts. Pterostilbene does, and research shows it acts directly on DNA damage in light-sensitive cells. A 2023 study in Nutritional Neuroscience found that older adults consuming wild blueberries daily for 12 weeks showed notable improvements in visual acuity and significant reductions in eye strain in low-light digital screen environments. Critical distinction: cultivated supermarket blueberries have measurably lower antioxidant density. Wild blueberries, small, dark, typically found frozen, carry nearly double the active compound concentration. Frozen is as effective as fresh. PRO tip: do not combine with dairy. Milk proteins bind to anthocyanins in the gut and block absorption significantly. No blueberry smoothies with yogurt or milk. Use oat milk, almond milk, or eat them with a small handful of walnuts. David, 67, a retired engineer from Vancouver, described his evenings as his eyes swimming by the time he tried to read before bed. After 8 weeks of frozen wild blueberries with walnuts, I don't reach for my glasses at the end of the day the way I used to. My eyes feel steadier. Number 3 is a fruit that still surprises people on this kind of list. But what it does for nighttime oxygen delivery to the retina is impossible to ignore. Number 3, red dragon fruit. The problem: retinal hypoxia, insufficient oxygen delivery to retinal tissue during sleep. You feel it as heavy, fatigued eyes even after a full night of rest, a flattening of color perception over the years, and blurring of peripheral vision. The key compound is betalains, found at meaningful concentrations only in the red flesh variety. White flesh dragon fruit does not contain significant betalains. These compounds support nitric oxide production in blood vessel walls, relaxing and widening the capillaries that supply the retina during deep sleep, directly supporting the oxygen delivery side of overnight repair. A 2022 study in Frontiers in Aging Biology found that participants consuming red dragon fruit extract for 6 weeks showed meaningful improvements in ocular circulation, statistically significant improvements in contrast sensitivity, and consistent self-reported reductions in blurry vision and visual fatigue. 1/2 to 1 red flesh dragon fruit, 60 to 90 minutes before bed, with a drizzle of olive oil or alongside a small handful of almonds. Pro tip: chew the seeds. Dragon fruit's small black seeds contain omega-3 fatty acids and magnesium, both documented in retinal nerve health research. Swallowed whole, almost none of that is absorbed. Chewed deliberately, you access the full benefit. We're in the top 2 now. Number 2 targets the most feared vision condition in adults over 60, and this fruit is one of the highest natural sources of the one compound that protects the specific zone where that damage begins. Number 2, goji berries. The problem: macular thinning. The gradual erosion of the macula, the central zone of the retina responsible for reading, faces, and color. Age-related macular degeneration is the leading cause of irreversible central vision loss in adults over 60. The key compound is zeaxanthin, and goji berries are among the highest natural dietary sources on the planet. Lutein and zeaxanthin both protect the retina, but they work in different zones. Lutein protects the outer retina. Zeaxanthin concentrates specifically in the macula. It is the macular pigment. When its density decreases, the macula becomes vulnerable to the damage that leads to central vision deterioration. A 2021 study in Nutrients followed adults aged 60 to 80 consuming dried goji berries 5 days per week for 90 days. Researchers found significant increases in macular pigment optical density, a direct measure of macular protection, with no participant showing further macular degeneration progression during the trial. 2 tablespoons of dried goji berries, 60 to 90 minutes before bed. Pro tip: soak them in warm water for 10 minutes first. Improves digestibility and zeaxanthin release from the berry matrix. Then pair with a small square of dark chocolate at minimum 85% cacao. Flavonoids in high cacao chocolate have been shown to enhance zeaxanthin absorption, creating a documented synergistic effect that delivers measurably more of the compound to macular tissue. This is the rare pro tip that is also genuinely enjoyable. Now, number 1. The fruit already in most of your kitchens. The one that targets the silent process most responsible for cloudy lenses and early cataract formation. The one with an enzyme most people have never heard of, and a preparation mistake almost everyone makes. Number 1. Papaya. The problem this addresses is glycation, one of the most underappreciated contributors to age-related vision deterioration, operating continuously and silently in virtually every adult over 60. Here's what glycation is in plain terms: excess glucose in the blood, even at levels well below diabetic thresholds. Just the steady elevation of a modern diet binds to proteins throughout the body. In the lens of the eye, it binds to crystalline proteins. When those proteins are glycated, they lose their transparency, they cloud. The compounds formed are called advanced glycation end products, AGs, and their accumulation in lens tissue is a primary driver of early cataract formation. In the retina, glycation degrades structural proteins and fuels the chronic low-grade inflammation accelerating macular deterioration. Most people over 60 are experiencing some degree of this right now without knowing it. The key compound in papaya is papain, a naturally occurring enzyme shown in research to interfere with glycation activity in ocular tissue. Papaya also delivers vitamins A, C, and E alongside folate, a combination consistently linked to tear film stability, retinal protection, and reduced oxidative stress. This fruit is addressing the glycation pathway, the inflammatory pathway, and the oxidative stress pathway simultaneously. A 2023 study in clinical gerontology found that older adults consuming papaya in the evening showed significantly lower circulating glycation markers at follow-up, alongside measurable improvements in tear production and notable improvements in contrast vision within 6 weeks. 1 cup of ripe papaya, cubed, 60 to 90 minutes before bed. Squeeze fresh lime juice over it before eating. Pro tip: remove papaya from the refrigerator 30 to 60 minutes before you eat it. Cold suppresses papain enzyme activity, Eating it straight from the fridge means you're accessing only a fraction of the anti-glycation benefit. Room temperature, always. The lime is not a garnish. Vitamin C in fresh lime significantly boosts absorption of vitamin A, delivering measurably more retinal nutrition than papaya alone. Eleanor, 73, a retired nurse from Bristol, came to me after her optometrist noted early lens clouding. She told me receiving that finding felt like a small earthquake inside my chest. We added evening papaya, room temperature, with fresh lime, alongside some simple dietary changes. 6 months later, her optometrist noted the clouding had not progressed. Eleanor told me, "I can see my grandchildren's faces clearly when they run toward me. That's what I came here for. That's what I got back." That is what this is really about. The 5 rules. Without these, you could eat every fruit on this list and still miss the full benefit. Rule 1. Avoid high-calcium foods within 90 minutes of your fruit. Calcium competes with lutein and zeaxanthin for the same gut absorption pathways, and research shows it can block their uptake by up to 30%. Keep dairy, calcium supplements, and high-calcium foods at least 90 minutes away from your evening fruit window. Rule 2. Always pair with a small amount of healthy fat. Lutein, zeaxanthin, lycopene, and betalains are all fat-soluble. Without fat present during digestion, they pass through largely unabsorbed. A small amount of olive oil, walnuts, almonds, or avocado boosts absorption of these compounds by over 50%. This isn't optional. It's the delivery mechanism. Rule 3. Wash gently under cool water. Never scrub. The skin and flesh immediately beneath it contain the highest concentration of antioxidants in almost every fruit on this list. Aggressive scrubbing removes a measurable proportion of those surface compounds. Rinse gently with your hands. Then eat close to the skin. Rule 4. Bring refrigerated fruit to room temperature before eating. Cold suppresses enzyme activity, particularly papain in papaya, but broadly across all of these fruits. Remove refrigerated fruit 30 to 60 minutes before eating. Let it warm. The biochemical outcome is meaningfully different. Rule 5. Eat 60 to 90 minutes before bed. Not earlier, not later. Too early, more than 2 hours before sleep, and the nutrients peak in circulation and clear before the retinal repair window fully opens. Too late, within 30 minutes of sleep, and active digestion raises core body temperature and disrupts the deep sleep stages where overnight repair is most active. 60 to 90 minutes is the window. It's specific for a reason. I want to come back to where we started. The morning when your eyes clear within minutes instead of an hour. The restaurant where you read the menu without squinting. The drive home at night where the headlights are just headlights, clean, contained, and your hands rest easy on the wheel because you trust what you see. The face of someone you love, seen in full detail, without effort. Those aren't small things. They are the texture of an independent life. They are confidence. They are being fully present in the world. You are not a passive observer of what's happening to your eyes. You can change the biological environment those eyes are living in, starting tonight, with what's already in your kitchen. No prescription, no procedure, just information applied consistently. Before you go, I want to ask you one thing. Not about your symptoms. If your vision became noticeably clearer tomorrow morning, if you woke up and the world came into focus within minutes, and the colors were a little richer than you remembered, what is the very first thing you would want to look at? Leave that in the comments. I read them, and those answers matter to me more than you might realize. If this gave you something worth sharing, please pass it along to someone over 60 who needs to hear it. Like and subscribe if you want more honest, evidence-grounded conversations about what you can actually do for your vision. The next video goes deeper into the sleep habits that either support or sabotage every intervention we talked about today. This is Dr. James. Take care of your eyes. They are irreplaceable.